Hi, everybody, and welcome to our Understanding Dementia presentation. My name is Kara Crook, and I'm a public education coordinator with the Alzheimer's Society of Thunder Bay and Region. So the presentation today is going to provide you with a brief overview of dementia and its symptoms. And furthermore, it's going to assist you in how to respond effectively when you are supporting someone living with dementia. So just a little Zoom disclaimer here we have to include. So please note we are using Zoom, an audio and video conferencing program that helps us connect with you virtually. We do believe the privacy measures put in place will allow us to connect securely with you, but we do apologize in advance should anything arise that's out of our control. And then if you do have any questions following the presentation today, I'm going to have my email on the last slide, so you can feel free to reach out to me anytime with any questions or comments. Okay, so just a little bit of statistics on dementia here. So as you probably know, dementia is becoming much more prevalent among Canadians. Currently, there's well over 550,000 Canadians living with dementia, and that number is expected to increase by 66% by the year 2031. So that's a really big increase really fast. And in Ontario alone, there's currently 240,000 individuals living with dementia. So this number is going up for a number of reasons. One being that Canadians are living longer due to things like better medications and living healthier lifestyles. Also, the baby boomer generation is aging as well. And it's also important to note that even though some stigma around dementia still exists, people are more willing nowadays to get a diagnosis of dementia just so they can begin to get the support that they need. Okay, so what is dementia? So first of all, it's important to understand that dementia is not a normal part of aging. So not every older adult will experience dementia. It's also not something a person can control, and symptoms can really be unique to each person. The most common symptoms we see that accompany dementia are memory loss, impaired judgment, and impaired speech and understanding. There's also different types of dementia, the most prominent form being Alzheimer's disease. And there's also reversible and irreversible causes of dementia, which I'm going to touch on throughout the presentation today. So it's important to keep in mind that dementia is not a disease, but rather a set of symptoms that accompanies a disease. And dementia is often used as an umbrella term, as there's many different types and variants of dementia. So do keep in mind that these 4 diseases that I'm going to talk about are progressive and a cure is still being explored. So the first and most known disease you'll see under the little umbrella there, our society is named after it, is Alzheimer's disease. So Alzheimer's disease is the most common form of dementia, as it accounts for 60% of all dementias. And the most common symptoms of Alzheimer's disease are increased memory loss as well as confusion. Next, we have vascular dementia. So essentially, this is caused by mini strokes that occur in the brain. So symptoms really depend on where in the brain these strokes are occurring and which artery becomes blocked. Because as we know, when an artery becomes blocked, it stops blood flow, right? So examples of some symptoms of vascular dementia include wandering, trouble concentrating or planning, as well as impaired judgment. And next we have Lewy body dementia. So Lewy body dementia is more common in men usually, and it often results in hallucinations and illusions later on in the disease. And Lewy body dementia is often misdiagnosed as Parkinson's disease, as they display very similar symptoms, which include difficulties with movement, shaky muscles, and difficulty with their gait while walking. So putting one foot in front of the other. An example I like to include here is if you think of the famous actor, Robin Williams. He passed away a few years ago now, but he was diagnosed with Parkinson's disease in the last few years of his life. But it wasn't discovered until after he passed away, and they actually did a brain scan on him, that he was actually misdiagnosed, and he was living with Lewy body dementia instead. So this just goes to show how easily and often the two diseases get misdiagnosed. And then last, listed under the umbrella, we have frontotemporal dementia. So it affects the frontal and temporal lobes of the brain, which controls our personality and how it's displayed. So this is why significant behavioral changes can be observed with this disease. So for example, a family member may come up to you and they say, you know, my mom hasn't been acting herself lately. In the past, she was so easygoing and quiet, and presently she's having outbursts and just being more verbally expressive to her loved ones. So this is all a part of the disease. And we typically see frontotemporal dementia in younger ages as well. Okay, so I'm going to talk a little bit now about the irreversible and reversible causes of dementia. So taking a look at the diagram on the left here, these types of dementia are progressive. So damage from the disease increases over time, which affects the brain. They're also degenerative. So brain cells break down, leading to the brain's inability to function as it would prior to the dementia diagnosis. Also, almost all forms are irreversible, so the damage cannot be repaired, and at present, a cure has still not been discovered. And then the reversible causes of dementia. So these can be caused by many things, many different underlying health issues, such as diabetes, thyroid problems, and vitamin deficiencies. Or a person might be experiencing delirium, have an undiagnosed UTI, a recent change in their medication, or they simply could just be dehydrated, so just not drinking enough water. Another common reversible cause to really take note of is delirium, because it can mimic symptoms of dementia. However, delirium is acute and it has a very quick onset of symptoms, and it's usually triggered by a major health issue, such as an undiagnosed infection. Okay, so we're going to take a little look here at some brain scans. So on the left is an adult brain not affected by Alzheimer's disease, whereas on the right is a brain that is affected by Alzheimer's disease. So we're going to focus on the brain scan on the right. You'll notice how the brain is smaller in size, and it also has enlarged ventricles as well. But I want you to really look at the two holes on the bottom of the affected brain. So this is the hippocampus. The hippocampus is responsible for taking your short-term memory and storing it into long-term reserve. So you'll notice how the hippocampus has shrunk significantly compared to the healthy brain, and it's almost non-existent at this point. So this is why a person with Alzheimer's disease may ask repetitive questions or repeat themselves 40 times. The area of their brain that's responsible for memory is just extremely impaired. So when you are supporting someone with Alzheimer's disease, it's always important to remind yourself of the physical changes that are happening in their brain, because it's never their fault that they may be behaving differently. And then there is a video here. I will get Natalie to email it to you so you can watch it following this presentation. Just a little video on YouTube explaining more about the physical changes that happen in the brain. Okay, so you always want to see the person and not the disease. So people with dementia are still people with unique abilities and strengths. They deserve to be treated with respect and dignity. Dementia does not define that person. And dementia affects everyone differently, and its progression varies from person to person. So a diagnosis of dementia does not immediately require a person to give up their job or change their routine. Seeing the person and not their disease helps us focus on what they can do rather than what they can't do. And focus on their abilities. So engaging people with dementia in activities that build on their strengths, it'll really improve their well-being, and it'll make it easier for them to live with the disease while enriching their quality of life. And you always want to use good communication strategies. So this is where your nonverbal behavior becomes very important, as it is our strongest communication style. But I'm going to touch on this more later on in the presentation. Okay, so I'm going to go over the 7 cognitive losses now. So we like to call them the A's of dementia. And of course we call them the A's because each loss starts with the letter A, but try to focus less on the names of each cognitive loss, as some can be pretty wordy, and instead just pay more attention to the symptoms that I'm going to talk about. So the first one is anosognosia. So it's the loss of ability to realize that there's anything wrong. So basically they're unaware that they don't know. So they may not know that they have dementia. They might still think they're employed, even though they've been retired for 20 years, for example. And this can result in them waking up in the morning and they just begin getting dressed for work and making their lunch for work. Another example with anosognosia is maybe they use a walker and they forget that they use a walker, which of course creates a fall risk. So you always want to remind them to use their walker, keep it in a place where they can physically see it. You could even decorate the walker with bright colors just so it's more visible to them. And another common example with this symptom is refusing medication. So a person might say to you, I'm not sick, I don't need to take those. So if this happens, a helpful hint could be for you to say, your doctor said you have to take this medication. And that can usually work because, especially with older adults, they have a lot of respect for doctors and they trust them. Or you could say, your daughter wanted me to make sure you take these. That can be helpful in that situation as well. So next we have agnosia. So this is the loss of recognition of sensory information. So an example I like to use with agnosia is, think of the task of brushing your teeth. This is something we all do every day, and we know what a toothbrush is used for. But a person with dementia might take that toothbrush and begin brushing their hair with it. Or they might just simply stare at it and not know what to do with it. So as staff in this situation, you want to just use cues as much as you can. So physically show them the motion of how to brush your teeth and just do things one step at a time. Another example is they may not recognize a family member or a staff member, and that's because their facial recognition area of their brain is impaired. So you may go to someone's home to support them, and they might think that you're their daughter, for example. Or with agnosia, they might not know what a utensil is used for when eating a meal. So for example, usually we eat soup with a spoon and we use a fork for potatoes, but they might get that backwards and try to eat their soup with a fork. So next we have aphasia. So it's the loss of language, which can include both speech and the comprehension of language. So this symptom is quite common, especially in Alzheimer's disease. So a person will generally just misuse their words. So maybe a person tells you that they have 7 cats, but when they go to show you their 7 cats, they take you to their fish tank and they show you their 7 fish instead. So in this case, they're mistaking the word fish for cat. Or a person might ask you for a cup of coffee, but instead they ask you for a slice of coffee. And aphasia is also something we like to call word salad. So this is when a person will just make random sounds and words that are strung together, but don't necessarily make sense. And they might revert back to their first language as well. So for example, maybe growing up, their mother tongue was Italian and they only start speaking Italian to you. So if this happens, you can use reminders for them to switch back to English. If not, if they keep speaking Italian, you can just go along with it. Just mimic their facial expressions and just use your body language to communicate. So next we have apraxia. So it's the loss of ability to initiate purposeful movement. So basically there's a disconnect between the brain telling the body what to do. So maybe a person is getting dressed in the morning and they put their clothes on in the wrong order. So maybe they take their bra or their underwear and they put it on over top of their clothes. So with this, maybe what you can do is lay out their clothes on the bed in the order that they're to put them on. So they can still remain independent with this task of getting dressed. Or maybe they're physically able to get dressed, but they're just having trouble maybe getting their arm into the hole of their shirt. So it's important for you to always just be present so you can help them through these steps. And another common example with apraxia is difficulty with directions. So it's important that you simplify or show them physically where they are to go. So if they ask you where the washroom is, you don't want to say, oh yes, it's down the hall and around the corner and the first door to your left. You want to direct them as clearly as possible and physically show them where they have to go. And next we have altered perceptions. So it's the misinterpretation of sensory information. So maybe a person sees a dog in the corner of the room, which of course isn't really there, but it's upsetting them as they're afraid of dogs. So you want to always validate what that person is experiencing or seeing. So you can assist that person by maybe helping shoo away the dog by going shoo dog shoo. This is also common in Lewy body dementia, as they can experience many hallucinations and delusions. And a person may also perceive changes in flooring as things they are not. So, for example, maybe a person approaches a black welcome mat at somebody's home, and they think that black welcome mat is actually a hole, and they don't want to enter that room as they can't perceive that it's actually just a flat mat. Or maybe there's a change in flooring. So maybe carpet that turns into tile, and maybe that person sees that as a step and they try to step over top of it, which can create a fall risk. Or maybe they just simply stop in their tracks and they don't want to walk on the new flooring that they approach. Another common example too, especially with personal care, is a person can perceive a white bathtub as a bottomless pit or an endless tub of water. And that's because there's no contrast in a bath that's filled with water. That person might just refuse to get in the tub because they simply can't see the bottom or perceive how much water is in that tub. So they might feel fearful or anxious about going and having a bath. So to help with this, what you can do is use bubble bath to help cover the water, maybe use a colored dishcloth for distraction, or use a colored mat on the bottom of the tub so they can physically see that there is a bottom. And you always want to try to make bath time an enjoyable activity. So even playing music can be a big help. Okay, next we have amnesia. So basically it's the loss of memory. So a person might repeat a story over and over, or they keep asking you what's for dinner, even if you just told them 2 minutes ago. So even if this might become irritating to you, it's important to act like you're hearing the story for the first time each time you hear it, because to that person living with dementia, they believe they're telling it for the first time. And an analogy I like to use with amnesia is to look at memory loss like an onion. So we know that an onion consists of many layers. If you think of the outer layers of the onion as representing your short-term memory and the inner layers of that onion as your long-term memory. So what dementia does is it removes those outer layers first and continues to remove those layers over time. So you can think that those core layers of that onion, those long-term memories, are going to remain the longest. So let's go back to using that toothbrush example. So keep in mind that brushing your teeth does have many steps. A person with dementia might not know those steps anymore because you have to wet your toothbrush, apply the toothpaste, brush your teeth, spit out the toothpaste. They might get stuck on completing those steps. So you always want to provide consistent routines. So having bath time at the same time of day, having dinner in the same place and at the same time, and always give them a meaningful activity to do. So especially something that relates to their past, because as I just mentioned, those long-term memories are more accessible. So if a person used to love old cars, maybe give them a vintage car magazine to flip through. Or if you knew that they enjoyed being creative in their past, maybe giving them a picture to color to embrace their artistic side. And you always want to engage with that person just as much as you can. And last, we have apathy. So the loss of drive or initiative. So maybe a person wants to be productive and they want to initiate an activity, but they simply forget that they can still do things. So as an example, maybe you go into somebody's house to support them and they're sitting in their armchair and they're staring out the window, but they're just not reacting or noticing any of the stimulus happening outside. And they're just not giving any emotional response. So maybe there's birds chirping outside, people walking by, and they might just be staring blankly and not responding to what's happening. So with apathy, it's important to engage that person in conversation. So focus on the long-term memories again and reminisce with them about their past. And always engage them in an activity they enjoy. So maybe doing a jigsaw puzzle or getting them involved with dinner prep. And sometimes it can make a huge difference to just sit with that person, hold their hand, and just be calming company for them. Okay, so these are just some examples of what the A's can manifest as. So they might think that staff are trying to hurt them. This can be common, especially if you're providing physical care. So maybe helping someone get out of bed or helping them get dressed. They might take that as you trying to injure them. They might think that staff and family are impersonators. So they might not trust you. They might not know what your role is. They might think their house is not their home. So they might still think that they live on their family farm from when they were a child, for example. And this can be common too, especially if they had a recent move, such as transitioned into long-term care. They might think strangers are living in their house. This can be common, especially if there's lots of staff turnover and lots of different staff coming to support them. So always introduce yourself and say what your role is, just to help them trust you and feel more comfortable. The misidentification of people. So maybe they think their son or daughter is just their friend and not a family member. They might think people on TV are real. So maybe you go to visit someone and they're watching an old wartime movie on TV and they just have a look of fear and anxiety on their face. That can be because they actually think what they're watching is happening in real life. So what you can do in that situation is maybe change the channel or turn off the TV entirely and just get them onto a different activity. And last, people are stealing from them. So here's an example of this. So maybe a person goes to the grocery store and buys themselves a couple groceries, and they come home and they put away their groceries, and they also take their purse and they put it into the refrigerator. And then a few hours later, they go to look for their purse. And of course, they can't find it because they put it in the fridge earlier. And then you come in as staff to support them, and you're the first person that they see, and they think, oh, that person must have taken my purse, and they accuse you of stealing it. So if this happens, you don't want to say, oh no, I didn't take your purse, I would never do that. What you want to do is validate what they believe to be true. So you can say, I'm so sorry that your purse is missing, let me help you find it. Because then that person's going to trust you. They're going to know that you're on their side. And then together you can help them find their purse, right? Okay, so navigating a call. So these are some tips on how to navigate a call with someone living with dementia. So it does have similar guidelines as when you're in person, but the visual factor is absent when you're on the phone, right? But you're still able to use your tone and the pace of your voice to help navigate or de-escalate a call, especially if they're upset. So with our current COVID times, phone calls have increased due to in-person contact being reduced. So you want to always keep your tone of voice calm, keep it kind and unhurried. It'll go a long way in creating a more enjoyable call for both of you. And you want to be patient. So always allow time for the person to speak and get their point across. They might just need some time to find the right words to say, or just express what they're feeling inside. And you want to be sure to explore and rule out pain or a new undiagnosed health issue, because this could be what's causing the aggression or agitation. So ask them how they're feeling and if they have any pain. And if you are asked to repeat yourself, try using the same sentence and wording that you used the first time and pause, just like I did there, because this allows the caller time to process what you're trying to say and respond when they're ready. So if this doesn't work, what you can do is choose different words or just rephrase to help them understand better. And always avoid the urge to correct. Even if you know what they're saying is untrue, this could lead to increased frustration for them and for yourself. So validate what they're experiencing or feeling and try to focus more on feelings rather than the actual factual content. And ask about their life growing up or some of their favorite things to do. Remember, their long-term memory is still intact, and it can be a helpful way to redirect and change the mood or tone of the call. So if this tactic doesn't seem to be working at the moment, try focusing on the immediate present. So talk about the weather, or ask them to look out the window and describe what they see, or just describe what's in their immediate surroundings. Sometimes these in-the-moment questions can be very helpful for immediate redirection. And if you notice that they are calling often, please try not to get annoyed. They're more than likely just feeling lonely or insecure. And again, you want to try to keep a warm, happy tone throughout the call, as many times this can make the caller feel safe and appreciated. Someone with dementia is very much aware of the emotions we project. They may even begin to mimic our mood. So keeping our tone calm and inviting, it can really go a long way. And we all love sharing a bit about ourselves. It can make us feel valued and included. So this is true too of someone living with dementia. And it shows them we value them and see them as a person and not their diagnosis. Okay, so all behavior has meaning. So why might these behaviors be happening? So it may be a result of the disease process. So the new presenting behaviors may be a result of the disease progressing along, or a new health concern, so maybe a UTI or an injury. So it's best practice for them to see their doctor to rule out any new health concerns. Are they in physical discomfort or pain? So always assess their facial expressions for any grimacing or look of pain on their face, and just ask them how they're feeling. Is there a possible change in routine or staff? So change can really trigger uncertainty and anxiety in people living with dementia. So try to remain consistent as often as possible. And if you're a new staff coming in, always introduce yourself and your role. And try not to take their behavior personally. So this is easier said than done, but please keep in mind that they're not doing these things intentionally to irritate or aggravate you. As I mentioned earlier, their brain is literally losing abilities, and it no longer has the full functioning of a healthy brain. And look for the person behind the disease. So always remember they're a person first and foremost. Their diagnosis does not define who they are. And build on their strengths. It helps them to feel involved and motivated. So if they're able to get dressed or participate in that task, just encourage them to do so. And focus on the positive. So help them celebrate their successes. With dementia, when symptoms progress, simple tasks such as tying your shoelaces or putting your cereal bowl in the dishwasher, it can become difficult. So focus on the positive and the strengths that remain and help encourage a positive outlook. And most importantly, meet people with dementia where they are and accept their reality. So this approach can not only be beneficial to them, but for you as well. Okay, so enhancing communication. So as language abilities decrease, a person is likely to become more sensitive to other people's nonverbal communication. People with dementia are acutely aware of others' emotions and body language. So when they pick up on feelings like frustration, tension, or stress, they may not understand the situation fully, but they'll definitely become more guarded. And in the moment, that could make your job more difficult, and that could create an undesirable outcome as well. So feelings like joy and happiness also have the same effect, but those create a more positive outcome. So always be aware of your nonverbal communication. Do a body check before you enter the room to support that person. Take a couple of deep breaths before you're entering their space. It can really go a long way to create a more positive experience for you both. Okay, a little bit more on communication. So I find this really interesting. Words are actually only 7% of how we communicate. The rest is mostly nonverbal. Our tone of voice is about 38% of how we communicate, which plays an important role. So always use a calm, unhurried, relaxed tone that can really create comfort. And body language accounts for 55% of how we communicate. So always keep an open posture and avoid looking closed off or unhappy. You can also simply communicate by just being with them as a person, doing an activity they enjoy, or just sitting with them, sharing eye contact and that smile. These are all forms of human connection, and these practices can really make them feel at ease. Okay, so recommended communication strategies for family and friends. So reduce distractions. By reducing distractions and presenting one idea at a time, it allows for them to process what you've said. Give additional cues and clues. So if you're at the dinner table and you see them staring blankly at their spoon, provide physical cues. So lift your spoon and put it in the bowl and rise the spoon to your mouth to show them how to actually eat whatever they're eating. And avoid arguing or reasoning. Even if you know you're correct, this only creates stress, and it makes it frustrating for the both of you and can generate feelings of mistrust. Take a break if you need to. So if you're feeling frustrated, give yourself time to just recenter. As I mentioned, people living with dementia pick up on our energy and our nonverbal communication. So they may not understand why you're feeling that way, but they'll be able to sense it and become more on guard. Be calm. So using a calm, even tone in your voice, being mindful of your body language again, Crossed arms, a frown, never underestimate the power of what that can do for the person you're supporting. So always just use a warm smile when you can. Make eye contact. This helps a person feel like you're connecting with them. Listen for related words and avoid open-ended questions. So if you're saying, you seem upset, what happened this morning? Instead, ask simple close-ended questions. Are you upset? Can I help you? And also match your verbal and nonverbal communication. Okay. So communication strategies for people living with dementia. So we encourage them to keep a pen and paper handy if they want to write down notes. Sharing challenges and coping tips with others. So this helps normalize what they may be feeling or experiencing. And remind them it's perfectly okay to take a few moments, relax, think about what they want to say or what they want people to do. The words often come when they feel less pressured, right? And if they can't remember, to simply say so. People living with dementia can quickly become masters of compensating for diminished skills. So we always encourage them to be honest. This can reduce anxiety and frustration, as well as help build that trust. We tell them, don't be afraid to tell others if you're having a bad day, because we all experience bad days from time to time. And often, time is needed to process what is being said or asked. So it's okay to ask people to slow down. And essentially, some of the best dementia knowledge and advice we have to share comes directly from people who are living with dementia each and every day. So that leads us into communication strategies for others. And these are written by people living with dementia. So as seen through their eyes, here are some tips. Offer gentle encouragement and quiet help when I need it. Treat me in the same way you would want to be treated. Write reminder notes for me where I'll be able to see them. Don't be afraid to ask me for help. Tell me your name and remind me of my connection to you. Allow me time to think, find the right word, answer questions, or write down my thoughts. Ask me how I would like to be. So these are important to remember as care partners living or working with people living with dementia. Okay, so now I'm going to talk a little bit about validation therapy. So what validation therapy means is you're just entering their reality, whatever that reality might be. So as I mentioned earlier, maybe a person sees a dog in their room and they're scared of that dog, but you know that there's no dog. So you just want to pretend to shoo the dog away, just to help that person alleviate their anxiety. Or another example, you may have seen or heard this happening with mirrors. Perhaps an older woman with dementia is looking at herself in the mirror and she thinks that she's 40 years old currently, but she sees a woman in the mirror that looks like she's 80 years old. And even though that woman in the mirror looks like her, she knows that she's not anywhere near 80 years old. So she thinks that's her mom in the mirror, and now she begins talking to her mom. But you know that her mom passed away 20 years ago. So if that happens, you don't want to say to this woman, oh, your mom died 20 years ago, I'm so sorry. Because if you say that, either she's going to believe you and she's going to relive that grief of losing her mom all over again, or more likely, she's not going to believe you. Because in her reality, that is her mom in the mirror, and she'll think that you're lying to her. This could lead to an argument with that person, and that's just an argument you're never going to win. So the best thing to do in that case would be to say something like, oh, your mom looks really great. Tell me about your mom. Join their reality and start a conversation about that person's family life. What was previously taught in dementia care was reality orientation. So it was believed that the more you told the person the truth, The more you told them it's 2021, you live in long-term care, your children are all growing up, et cetera, they thought that eventually that reality would stick for that person. But we now understand that dementia is a progressive disease. So constantly telling them or correcting their reality does not help. It only makes them feel more distressed, more confused, frustrated, and they just won't trust you because you're not going along with what they believe to be real. So in dementia care, it's best practice to always use validation therapy because you're just entering that person's reality of what they believe to be true. And there's no harm in doing that. So some people might say to us, well, isn't that just you lying to the person? And yes, even though you are lying, we like to call it a therapeutic fib because more accurately, it avoids challenging their reality, which is just as real to them as our reality is to us. So always use validation therapy when you can. Okay, so always remember a person's strengths. Dementia is a diagnosis, it's not who they are. So here are some 6 things about dementia. I like to refer to them as the I can still list, and this is written by someone living with dementia. So I can still smell the flowers, I can still communicate, I can still make decisions, I can still wash my face, I can still sing, I can still move my body. So some remaining strengths, which are very, very important to focus on. Emotional awareness. So a person with dementia can perceive your emotions. So they're able to pick up on your body language and how you may be feeling internally. This is why it's important to always be aware of your nonverbal language and always use smiles and a happy tone. Before entering the room, again, do a body check-in, adjust to a more approachable and relaxed demeanor. And with emotional memory, a person with dementia will remember how you made them feel the last time that they saw you. So they might not remember your name or they might not remember what you said to them, but the feelings they experienced with you are still remembered. This part of their memory still remains. Use of senses. So individuals with dementia still have their basic senses. So taste, touch, smell, sight, and hearing. This is why it's important that you engage in activities that incorporate these senses. So for example, maybe listening to their favorite music to satisfy hearing, or watching a musical performance on YouTube for sight. You can also engage in an activity that incorporates more than one sense. So maybe cooking with different spices for taste, smell, sound, and sight. And long-term memory still remains in individuals living with dementia, as I mentioned earlier. So when engaging in conversation, try to focus on that person's past. Ask them about memories they have, such as their wedding day, where they went to school, what hobbies they had. This is an approach that we call reminiscence therapy. Another type of reminiscence therapy may involve looking through an old photo album or smelling familiar scents. Music therapy. So music appreciation, it's extremely beneficial for individuals living with dementia. It can bring on happy memories, improve well-being. It can calm a person if they're having behaviors, and it promotes reminiscing as well. So try playing music from their younger days or music that promotes relaxation. When I worked in long-term care, we had a resident who only spoke Italian, and after breakfast, she would always be in her room and she would be having behaviors and yelling out and just being very verbally expressive. So what I would do as staff is I would go in there. She had a CD player with many Italian CDs. I would put on a CD and I would sit with her and hold her hand and just be present. She would listen to the music, and honestly, after 5-10 minutes, she would be completely relaxed, having no more outbursts, and you can just see on her face that she had become calm again. And sense of humor. So I love using humor, having an easygoing and silly approach. It'll come with positive interactions. So crack a joke, show them a funny picture, watch a funny animal video on YouTube. Just use laughter whenever you can. We all know that laughter releases endorphins, which is the body's feel-good chemical, right? So I always like to think of the old saying, if you don't laugh, you'll cry. So try to keep that in mind. And people with dementia have the same needs as us, such as having a purpose and being a part of something. So have conversations that include them, involve them in tasks, ask them if they would like to help you with setting the dinner table, things like that. Individuals living with dementia are social beings just like us. Okay, so this is a quote that I really like. So a person with dementia's well-being is always either enhanced or diminished by how we choose to relate to them. So as I mentioned earlier in the presentation, dementia is a progressive disease. Their actions or reactions are often a way of communicating. Their brain is literally shrinking and their functions and abilities are diminishing. So please just always be patient. This is not always an easy ask. It's difficult for us to fully comprehend what they're experiencing and how their decline in abilities is making them feel. So please treat them as a person first and foremost. Remember, a warm smile, a comforting tone, and open and welcoming body language can really go a long way. Okay, so rethinking dementia. Here are 10 tips to help you communicate with a person who has dementia. So always approach the person from the front. If they're seated, go down to that level so you can maintain proper eye contact. And don't approach the person from behind or somewhere where they can't see you, as you might startle them. Always identify yourself. So for example, saying with a warm smile, "Hello, my name is Kara. May I help you put on your jacket?" Maintain eye contact. This is an important communication strategy to have. It can also help them feel heard and safe as well. And address the person by name. So always use that person first language and speak in a clear, positive tone. Present one idea at a time. So giving a person with dementia too much information at once can be overwhelming and it's just too much stimulation for them. So take things slow, be patient. It might just take them some time to process what you're saying. And repeat or rephrase as necessary. So if a person is not understanding, repeat using the same words, but if this doesn't work, try rephrasing or using gestures or visuals to help them understand. And ask yes or no questions. So for example, you can say, "Can I help you?" and get them to show you instead of asking, "What do you need help with?" Use gestures. So they can really assist in getting your point across. So make sure you keep an open stance as well so the person feels more comfortable. You want to avoid crossing your arms or looking unhappy. And listen actively. So acknowledge what they're feeling so they feel heard and understood. If a person is emotional, use an empathetic approach and show your compassion. Be vulnerable with them. And let the person know if you're going to touch them. It avoids catching them off guard or making them nervous. Always use a firm yet gentle touch. Okay, so I'm going to talk a little bit now about a program called Finding Your Way. It was developed by the Alzheimer's Society of Ontario. And the Finding Your Way program focuses on raising awareness and the risks for people with dementia going missing, including how to prevent those missing incidents by creating a safety plan for those individuals. So right now, 3 out of 5 people with dementia in Ontario will go missing. So that's over half. So that's an extreme amount of people living with dementia that will go missing. So if they do go missing and they're not found within 24 hours, there's a very high chance of the final outcome being fatal, unfortunately. So you can probably think of a lot of risks in your community, especially in Thunder Bay. We have large forest areas, large bodies of water, severe weather conditions, especially very cold winters, high traffic areas, and lots of rural highways. So there is immediate risk for someone with dementia when they do go missing. So why is finding your way important? Well, there's 200,000 Canadians living with dementia in Ontario, and 6 out of 10 people with dementia will go missing. So as I just touched on, half of these missing people who are not found within that 24-hour window will end up gravely injured or worse. So if that wasn't extreme enough, almost 90% are found within 1 and 1.5 kilometers from where they live. So prevent, be prepared, and know what to do if this happens. This is why the Finding Your Way program is so important. Okay, so if you go to the Finding Your Way website at findingyourwayontario.ca, it offers different resources to inform, prevent, and help. So there's resource guides that care partners can use to live safely at home. Also practical guides, including how to obtain an identification kit. And an identification kit will allow you to fill out information about their loved one. So maybe a person's physical description, including a photo, also places they like to take walks, or spots they may go if they are missing. So this is excellent information for a care partner to carry with them. So for example, if a person you're caring for goes missing and you're trying to tell the police basic information while you're stressed and worried, it can be very difficult to think clearly. And when the police ask you to give a description, you might say, oh, they have gray hair and glasses. Well, there's a lot of people who have gray hair and glasses, right? So having that specific information in that identification kit can really be helpful in that moment of stress and anxiety. It gives you the ability to hand search and rescue a complete document with prevalent information on the missing person, which really saves precious time that can be used to be searching instead. So if you visit findingyourwayontario.ca, there's 4 online learning modules you can take. They only take 15 minutes each, and it's all about the risk of going missing for someone with dementia. So it covers prevention practices, how to communicate or approach someone you think might be lost. So if you have time, we do really recommend you take these 4 modules. They're really informative and valuable resources for information on what to do. Okay, so tell us what you think of this presentation. So I do invite you to complete the Finding Your Way survey. The survey does only relate to the Finding Your Way information I just gave you, but the government provides funding for this program, and they want to know if what we're presenting is effective, if we're doing a good job of presenting it. So if you're able, please do complete the survey. I do know that Natalie will provide it to you following the presentation. Okay, so some services of the Alzheimer's Society that we offer. So at the Alzheimer's Society of Thunder Bay, we provide individual and family counseling over the phone and by using Zoom. We also provide public education virtually, like we're doing today with our Zoom platform. And we also hold virtual Minds in Motion programs, which are hosted by me. We usually have them once a week for 1 hour. We do half an hour of things like games, mental stimulation activities like Jeopardy or trivia. We also do seasonal virtual art programs, and while supplies last, we offer activation and caregiver kits. So they have different activities you can do at home, such as painting activities, reading, card games, dice games, things like that. How you can help. So the number of Canadians living with dementia is expected to increase by 66% by the year 2031. So this is a very dramatic and rapid increase. Right now, we receive just over 65% of our funding from the Northwest LHIN. Our counseling, support groups, and the programs that I just talked about are provided at no cost to our clients, but we always do rely on donations to keep our programs up and running. So if you're interested and able to donate, you can visit alzheimer.ca/Thunder Bay and click donate now. And the funds raised will stay within the region and locally. So if you make a donation, you'll know where your donation dollars are going and how they're making a difference. So they always stay local and within our region as well. Okay, so that concludes the presentation for today. So I want to thank you very much for being here. If you do have any questions, I do have my email here. It's recreationtherapist@alzheimerthunderbay.ca. You can also call our office, 345-9556. And if you want to explore more information, you can visit alzheimer.ca/Thunder Bay. We have a lot of very informative resources and information on there. Okay, so thank you so much, and I hope you have a great rest of your day. Bye-bye.